Hello, my name is Leopoldo Dávalo Zapata. I'm medicine student from Universidad Autónoma de Durango, Campus Monclova, and I'm here to talk about the topic COVID-19. Coronavirus disease 2019. Severe acute respiratory syndrome coronavirus 2. Cases COVID-19. SARS-CoV-2 is a new virus. The first cases were identified in people with pneumonia in Wuhan, China, in late December 2019. It probably started in animals but is now spreading between people. As this virus is new, we are learning more all the time. And what we know now may change. The World Health Organization declared the situation a pandemic on 11 March 2020, signifying widespread human-to-human transmission, large number of affected countries. Although there is a lot we don't know yet about this new virus, we can still prevent the disease. How is COVID-19 spread? Most people are being infected from other people when it's close contact. It probably spreads the same ways as colds and flu. Droplets which are created when we talk, cough, and sneeze. People in close contact can get infected when these droplets enter the nose, eyes, or mouth, or when the infected droplets are inhaled. Touching contaminated objects puts the droplets onto your hands. If you touch your face, the droplets can enter your nose, eyes, or mouth. Infected people with minimal or no symptoms can spread COVID-19. Symptoms start like many other illnesses. Common symptoms include fever, cough, sore throat, fatigue, shortness of breath. Symptoms start about 1 day after exposure, but can be as long as 14 days. Most people develop symptoms within 5 or 6 days. It can also cause many other symptoms, including headaches, muscle ache, sudden loss of sense of smell and taste, running, stuffy nose, diarrhea, rash. Some people have no symptoms, must have a mild illness. It can be severe and sometimes fatal. Many patients recover fully in about 2 weeks. In others, some symptoms like breathlessness and fatigue may continue for weeks and months. There is no specific treatment. Mild symptoms can be treated at home with medicine to lower the fever or relieve pain. If symptoms are more severe, treatment in hospital is required. Because symptoms are similar to many other illnesses, tests are needed to make the diagnosis: nose, throat swab, blood test. Prevention. Reduce the spread of infection. Wear a face mask or cloth covering nose and mouth when in a public. If you have any symptoms, even if only mild, stay home. Check medical advice following local guidelines. Wash your hands frequently with soap and water. Use alcohol-based and hand sanitizer when soap and water are not really available. Cover your cough and sneeze. Do not use your hands. Instead, use tissues on your upper lip. Immediately throw the tissues in bin and wash your hands. Reduce the spread of infection. Avoid touch-sharp objects like switches, hand reins, dog hand, etc. as much as possible. If you must touch such objects, wash your hand on sanitizer properly afterwards. Ensure you do not touch your face. Clean and disinfect frequently touched surface each day. More often in you think they have been contaminated. Use normal cleaning supplies. Do you not share foods, drinks, and personal items includes mobile phones? Do not travel if you are sick. More one use of mask. Follow local guidelines. Wear a mask when in a face-to-face contact with others, when social distancing cannot be achieved. If you are the high-risk group, within healthcare facility of other public spaces, wear a medical mask when you coughing in or sneezing, when caring for a sick person. Masks alone don't protect. They should be used along with other hygienic measures. Follow manufacturer's advice for using the mask. Masks reduce the risk of the wearer spreading the virus. Avoid potential exposure. Stay home as much as practical. Maintain social physical distance. Keep 1-2 meters, 3-6 feet away from others, even if the upper wall. Avoid crowded places. Maintain social distance when greeting visitors. Avoid shaking hands, kissing, or hugging. Minimize gatherings with friends and family. Preventions. Avoid personal exposure. Work from home where possible. As far as possible, use private transport. Avoid public transport. Keep away from people who are sick. Don't let them cough or sneeze on you. Avoid visiting hospitals and other medical facilities unless you need medical care. Are you ready for COVID-19? Prepare yourself and your family. Monitor the situation. Know your local helpline numbers and be aware of the local procedures. Ensure you have access to the essentials such as food, water, household supplies, and medicines. Speak to your doctor about any chronic medical condition you may have and get the under optical control. Keep its best possible health. Get the recommended amount of sleep each day. Eat healthy diet and keep up regular physical activity. Consider now how you will manage if authorities impose restriction for a couple of weeks. Plan to able to look after a sick household member. Get the flu shot. This will reduce the risk of seasonal flu and possible confusion with COVID-19 symptoms. What do you if you get sick? Stay home if you have mild symptoms. Do you go to work? Do you not? What do you if you get sick? Stay home if you have mild symptoms. Do not go to work. Minimize contact with the people in the household until you have recovered. Monitor your condition. Follow local guidelines for self-isolation. Cover your cough and sneeze. Use tissues or masks if available, and wash your hands with soap and water. Check medical attention. If your symptoms worsen, make an appointment. Wear a mask in case you need to visit a doctor. Use private transport and much as possible. Screening and contact tracing. It's important to stop the spread of the virus. Screening may be done at entry points to detect sick people. You may be asked where you have been and your temperature may be taken. Health authorities may perform contact tracing. Identify people who have been in contact with someone with COVID-19. These contacts may be asked to stay at home for 19 days so they don't infect other people. To monitor their health for 14 days in case they developed symptoms. Follow the advice of health authorities. Coping with stress during the COVID-19 outbreak. COVID-19 can be stressful. The effects can be both physical and emotional. Things you can do Coping with stress during the COVID-19 outbreak. COVID-19 can be stressful. The effects can be both physical and emotional. Things you can do to reduce stress. Take breaks from listening to, watching, or reading about COVID-19 frequently. Include social media. Focus on the fact of COVID-19 and understand the risk to yourself and those you care about. Separate facts from rumors. Gather information from the reliable sources. Find time to unwind. Contact with friends and family. If stress continues to hamper your daily activities, talk to a doctor or someone you can trust. Keep yourself in the best possible health. Sleep well, eat healthy, and be physical activity. For more information on COVID-19, you can visit this website. Thanks for your attention. Goodbye.